Hello everyone, this is a lecture on the topic Fundamentals of Fundus Image. This is Dr. Anirban Das Gupta and I will explain the fundamentals of fundus image in this lecture. So imagine that you want to detect the onset of blindness before a patient even notices any symptoms of blindness. So the question is that how can we look inside the eye non-invasively and analyze it using some form of imaging? The answer to this question is fundus imaging. So fundus imaging is a simple yet a very powerful way to capture the back of the eye. So what is a fundus image? So if you look at this picture, so this is called a fundus image, and in this photograph you can see that this is the image of the interior surface of the eye, which is also called the retina. Now if you closely look at this image, there are three main structures which are very important in the analysis of fundus image. First is the optic disc. So this circular region, which is kind of yellowish, is called the optic disc, and this is where your optic nerve exits from the eyeball. The second region or structure which is very important in a fundus image is called the macula. This dark patch, if you can see, this is called the macula, and this is responsible for central vision. What is central vision? That is the sharp, detailed, high resolution color vision. And here when the light falls, you get the proper clear vision. The third is basically your retinal blood vessels, and here you can see there are several blood vessels. So these blood vessels indicate systemic health, means the overall health of the body. For example, there are 11 systems which are interconnected, and if you have a disease or condition in one area, that affects the entire body rather than just one localized spot. Like for example, diabetes, influenza. So these are called systemic diseases, and they involve multiple organs or bodily systems. So one more important aspect of this fundus image is the ratio of this optic cup and optic disc. So here if you see optic disc, we already discussed this large yellowish region, and optic cup is here. If you see the blood vessel, it is forming a kind of a cup like structure. So this is called the optic cup. So based on these ratios and the color of these optic discs, there are several disorders or ocular diseases which can be detected. I'll just name some few of them. For example, glaucoma. Glaucoma is a disease which is caused by increased intraocular pressure which damages the optic nerve. And in this case, what happens is there is an enlargement of this optic curve, and also the cup to disc ratio is increased. Then we have optic atrophy, which is degeneration of the optic nerve. And here you have your optic disc which becomes pale in color. Then diabetic retinopathy, which is caused by prolonged high blood sugar, and it damages the retinal blood vessels. So in diabetic retinopathy, you have basically small red dots and yellow deposits on this fundus image. Then age-related macular degeneration, which is basically a disorder which affects the macula, and the patients typically lose their central vision, and tasks like reading and recognizing faces becomes difficult. So here also you find some kind of yellow deposits. Let me take an example. So here you have a normal retina and a diabetic retina. So here, as I said, that in the diabetic retina, so you have some red dots and yellow deposits on the fundus image. So how is this fundus image formed? The question is, how do we capture a clear image of something inside the eye without even touching it? And the answer lies in the physics of how light interacts with the retina. So fundus imaging works on the principle of illumination plus reflection plus your imaging optics. So if you see this diagram, so there are illuminating light rays, these depicted by these green lines or green rays, and then the imaging light rays which are reflected back from the retina to form the fundus image, which are depicted by these pink light rays. So the first step is illuminating the retina. So here in this case, a low intensity light source is directed into the eye through the pupil, and this light passes through the cornea first and then the lens, and finally it reaches and illuminates the retina. And then there is refraction in the cornea and the lens, which basically focuses this light. Now in the second step, which is the reflection from the retina, so this retina acts like a diffuse reflector, and this light is reflected back, which carries structural information. Structural means the structure of the different regions of the retina, which actually is reflected in the fundus image. Like different tissues reflect the light differently. For example, blood vessels are depicted as darker in the fundus image, optic disc is depicted brighter, the lesions have irregular reflection, and so on. And then finally this reflected light helps in the image formation, which is captured by this camera system or your optics, which is also called the fundus camera. And then based on this coaxial illumination and observation, this image is basically analyzed, and there are lenses which focuses this reflected ray onto the sensor of your fundus camera. So thank you so much. Hope you learned something new in this lecture.